Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative, and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
This is the MidAmerica PTTC podcast, where we believe prevention is better together, and together we are stronger. I'm your host, Dave Clausen, and I'm the director of the MidAmerica Prevention Technology Transfer Center. This is episode 44, and in today's episode, I had the pleasure of speaking with Karen Vosch, and, well, Karen is a branch chief for the DrugFree Communities Program within the Division of Overdose Prevention in the National Center for Injury Prevention and Control with the CDC. Now, in this episode, we're going to unpack the DrugFree Communities Program, DFC for short, and highlight some of the major activities DFC coalitions focus on, share the big impacts they're making, and give you some resources so you can apply for DFC funds for your community. But first, a little more about Karen. In her career with the CDC, she's led a number of efforts in communication, strategic planning, budgeting, and partnership development for the Prevention Research Centers, the Alcohol Team, the Division for Heart Disease and Stroke Prevention, and the Healthy Schools Program. She has also helped to create new programmatic initiatives for several community-based programs, such as the STEPS program, Communities Putting Prevention to Work, and the Racial and Ethnic Approaches to Community Health program. Karen also has an international health background, having served in the Peace Corps in West Africa and as a CDC assignee on non-communicable diseases and road safety issues in Botswana. Talk about just an amazing background. Y'all are going to love this episode. But before we get into the content, we would like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into today's episode. All right, listeners, I would like to welcome Karen to our podcast.
Thanks, Dave. It's a pleasure to be here, and I'm really excited to talk with you and your listeners today about the DFC program.
It is an absolute honor. Been looking forward to this episode for a while. But before we get started, can you share a little bit about your background and how you came to the CDC?
Sure, I'd be happy to do that. I think if I had to think about my background, I've always been drawn to community work. I started as a Peace Corps volunteer in West Africa, and that experience taught me so many lessons about working in a community, the importance of language and culture and the critical step of knowing who those key decision makers are and involving them along the way, and the hard work of implementing behavior change programs from start to finish. And there were countless lessons there, and it drove me to get my master's in public health and health behavior and health education at UNC Chapel Hill, to learn about what drives human behavior and behavior change. And I've really applied all of those lessons in my work at CDC. I joined the agency in 2003, and during my time there, I've built and supported large community-based initiatives. I've developed partnerships and learned about the effectiveness of promoting those strategies that really help to change the environment at the community level. And those are the strategies that really work. And that's why I jumped at the chance to lead the DrugFree Communities, or DFC, program at CDC. And I'm just so honored to have the opportunity to do that and to support a program that works directly with community-based coalitions and promotes positive behavior change among youth.
What a wonderful and rich background. I would love to dig into it, but we'll save that for another episode. Now, I got to tell you, I'm a little curious. With your title, Branch Chief for DrugFree Communities Branch, And with the DFC for short, transition to the CDC, can you just kind of unpack what is the DFC program?
I think many of your listeners may be aware of the DFC program, also known as the Drug-Free Community Support Program. And this is the nation's leading effort to mobilize communities to prevent and reduce substance use among youth. The program was created in the late 90s within the White House Office of National Drug Control Policy, and it now funds over 700 community-based coalitions across the country. And these coalitions implement youth-related prevention strategies focused on a wide variety of substances. They include alcohol, tobacco, marijuana, prescription drugs. ONDCP also funds, and this is a long name, the Community Based Enhancement Grants to End Local Drug Crises, or the CARA program. And that provides additional funding to current and former DFC coalitions to focus on particular substances, prescription drugs, but in addition to that, opioids and methamphetamine use. The theory really behind all of these programs is that the solutions to prevent youth substance use lie within each respective community, and that a small amount of federal funds, folks can apply for up to $125,000 per year, and combining that with a local match of resources and volunteer support can help mobilize those community leaders and help them identify and respond to the drug issues that are unique to their area, and really focus on the environmental conditions and the things that may be driving young people to use substances. Hence the tagline, local problems, local solutions.
I might be a fan of taglines, with mine being prevention is better together, and together we are stronger. So I love that. Local problems, local solutions. All right. So what is the CDC's role in that DFC program you just shared with us?
Yeah, well, we are somewhat of a newer partner to the program. So as of October 1, 2020, CDC became the day-to-day manager of the DFC program. And what that means is that we provide grants management and programmatic support to the DFC coalitions. We assign staff to each recipient to help them understand how they can allocate their budget, ensure that they're meeting the requirements of the grant, and help them to support their programmatic efforts and achieve the goals and objectives of their program. We pride ourselves on providing excellent customer service to our coalitions and ensure that they have the tools and resources available to them to prevent youth substance use in their communities. We're also located within CDC's National Center for Injury Prevention and Control, and that center houses our overdose prevention programs and violence prevention programs. And we work really hard to connect those programs and other relevant CDC programs with DFC recipients and community-based coalitions. And we certainly do not do this alone. We work in close collaboration with ONDCP, which provides the overall strategic direction, oversight, and funding, and also the Community Anti-Drug Coalitions of America, or CADCA. Many of your listeners probably know CADCA, and they are responsible for providing training and technical assistance to DFC coalitions. And also we work in collaboration with ICF, which is a kind of consulting company and helps to support the national evaluation of the DFC program. So all of us work together, and we're here to help coalitions succeed to prevent youth substance use in their communities.
What a lovely lineup of folks coming together around prevention efforts and really serving the communities. Wonderful stuff. Makes my heart happy.
Well, we definitely appreciate the collaboration because working together is really so important to help those coalitions.
Absolutely. Absolutely. So as we kind of keep talking about the DFC program and the DFC coalitions, what are some of the major activities that the coalitions focus on?
So I'm glad you asked that. I think when we say local problems, local solutions, But we're also, there's also some common activities that coalitions do across the board. So they do conduct ongoing community assessments, and those assessments are used to plan strategies and develop and implement what we call the 12-month action plan. And that 12-month action plan is supposed to be community focused, where they're looking at the entire community and seeing what they can do to create change to prevent youth substance use. So not just focused on, individual young people. Coalitions choose the substances that they address in their communities, so they have the flexibility to do that. So as I mentioned, the DFC program focuses on preventing alcohol, tobacco, marijuana use, prescription drugs. So they're required to and have the flexibility to address at least 2 of those substances as they develop their 12-month action plans. And they, I mentioned focus on affecting community level change by, identifying and implementing those initiatives that can address the entire community and do a comprehensive approach. So instead of just educating a young person, you're not only educating that young person, but you're also looking at the school environment, you're looking at the community environment, and you're looking at other factors around there to see what's influencing the behavior in your community. And that all comes together to achieve the goal of reducing youth substance use.
I love it. And I'm going to add to my list. Let's unpack comprehensive approach on another episode because that is so important. So important.
So important.
Yes, indeed. Well, I kind of want to drill just a little bit deeper when it comes to the DFC coalitions. What makes up a DFC coalition?
Well, I'll start with the official definition and then I think talk about what happens in practice. So the DFC program defines a coalition as a formal arrangement for cooperation and collaboration between different groups or sectors of a community in which each group retains its identity, but all agree to work together toward a common goal. For the DFC coalitions, they are required to involve 12 sectors, and these include youth, parents, schools, business and media, and others. And you can find the complete list of sectors on the CDC DFC website. In practice, we find that effective coalitions are made up of those movers and shakers in your community. And many of your listeners probably know who I'm describing. It's the people who show up at the meetings, who commit to activities, and who get things done. And we're also seeing, based on the latest ONDCP report, that approximately 60% of coalitions also host a separate youth coalition. And this is a group of young people who work together to plan and implement activities related to the mission of the full coalition. And they're mentored by an adult coalition leader. And this is a wonderful way to foster youth engagement, which is a critical component of success and particularly important in light of COVID-19.
I tell you what, talking about engaging the youth, empowering the youth, absolutely loving everything you have to say. I've got, surprise, another question for you. What are some other ways that the CDC and your partners help communities really achieve that community level change?
So one thing that has been done over time for the DFC program, and something that we are continuing to do, is its promotion of what we call an evidence-based framework. And this framework is called the 7 Strategies for Community Level Change. And this was a framework that was developed by CADCA. And the 7 strategies for community level change represent that comprehensive approach that we were talking about before. And so within a framework like this, it addresses many different levels. So you want to look at the individual, you want to look at young people, for example. Then you want to look at the relationships that those young people are maybe having amongst their peers, with their parents. And then you want to look at the organizations where the youth spend a lot of their time, youth serving organizations, schools, and also the community at large, the businesses and the systems that are, and policymakers and decision makers that are helping drive the decisions in a community. So if you look across those different levels, the goal is to implement strategies that look at all of those different levels and address them. So For individuals, you might be providing information and enhancing skills. You might provide support to build up the relationship between and amongst individuals. You might want to look at also enhancing access and changing consequences, enhancing access to things that support youth substance use prevention, and changing consequences to ensure that communities are not do not have a lot of drugs coming in them, for example. And then, kind of being aware of the policies that have a role in influencing that community environment. So if you complete that entire package and you're addressing all of those different levels, we see that as a kind of comprehensive approach that encompasses all of those 7 strategies. And that can really help foster not only, individual behavior change, but change in the community as a whole.
I like it. The 7 strategies for community level change. Yes, you're spot on. It really does frame and drive for that comprehensive approach. I like it. I like it. Now, you know, the DFC coalitions have been around for quite some time. Where can we go? What can we look at? How do we know whether these coalitions are making a difference with that community level change?
This is a great question. I would say yes, unequivocally, we do see that coalitions are making a difference. And this is based on the latest evaluation report from ONDCP. And coalitions are reporting a significant decrease in marijuana, alcohol, tobacco, and prescription drug use in youth who live in their communities. And this is based on data that coalitions collect every 2 years on those 4 substances, and they collect them from at least 3 grade levels in their community. And if you want to go into more detail from that report, you can find that ONDCP report on CDC's DFC website. What I would say, kind of beyond the statistics, is that DFC coalitions play a critical role engaging the youth of their communities. And when you're trying to create a behavior change, trying to change the behavior of young people in your community, it's so important to involve them right from the start, and work to help support their health and well-being. And that is now more important than ever, and something that DFC coalitions do very effectively.
It makes me just want to just shout with joy, just knowing that these coalitions are making the difference. And earlier on in the episode, you mentioned there's some 700 coalitions funded across the country. What about in our MidAmerica region?
Well, I'm glad you asked that question also, because we'd like to see more coalitions funded, in this area of the country, and want to encourage your listeners and coalitions from this region to apply. Because while there are over 700 coalitions, there's actually only 31 funded as of fiscal year 2020 across the 4 states in this region. So um, for Missouri, we have about 13, Iowa has 8, Nebraska has 3, and Kansas has 7. Um, and, one of the reasons we'd like to see more coalitions from this area is that, we have seen some concerning trends. And I mean, these concerning trends in terms of overdose deaths are occurring across the country, but in this region in particular as well. CDC routinely collects and reports data on the use and misuse and overdose of opioids, cocaine, methamphetamines, and other substances. And there was a report that was released that showed that the Midwest had the largest increases in deaths involving psychostimulants and in cocaine involved overdose death rates. This is back from 2016, 2017, but the data have been released more recently. And as of 2019 in the Midwest, over 40% of overdose deaths involved psychostimulants. So we really want to encourage the primary prevention strategies that we know work. And we feel that, more DFC coalitions in this area would be beneficial.
When it comes to prevention, we know what works. And quite frankly, we know drug-free coalitions work as well at creating that community level change. So listeners, I'll put a link in the show notes for you when it comes to getting y'all signed up and applying for a DFC. But let's actually talk about that. How would a community go about applying for future DFC funding? Any tips for success?
Well, first, I'd like to encourage all of your listeners to routinely visit grants.gov. That's www.grants.gov. This is where you can find the funding announcements for the DFC program, but also any other federal program. We release funding announcements every year for DFC coalitions, and that is usually during the first quarter of any calendar year. So as you are visiting grants.gov, just type in DFC in the search bar. And you can also visit the CDC DFC website and subscribe to the CDC's drug overdose listserv, which contains information about funding announcements and other information related to drug overdose prevention. I do want to mention a couple of eligibility requirements because I think they're important for your listeners to know about. Coalitions have to be in existence for 6 months. That's one of the eligibility requirements. So if you're thinking of applying to the DFC program, just make sure that you have that coalition in place and that it has been in existence for 6 months. Also, that the coalition's mission statement has to be related to the reduction of youth substance use, and the coalition must be able to accept federal funds. And we've seen this occur before, that either directly as its own 501c3 or in partnership with a fiscal agent if you have a coalition that doesn't have its own organization. So I encourage everyone to watch the DFC eligibility requirements presentation by ONDCP to learn more, and that link is in the show notes. And we also, there is also a video there about these requirements in Spanish.
All right, another link we'll have in the show notes. And thanks for directly speaking to those eligibility requirements. That really does help for our listeners. Now, let's say a new coalition is awarded DFC funding. What kind of resources or training and technical assistance and other things y'all have to support those communities?
Well, CDC has a long history of working with states and communities, and we are building upon that support, on that expertise to provide support to DFC coalitions. So a few examples, we are providing a series of webinars that are on topics that are important to coalitions. So these can include and have included adverse childhood experiences, school health strategies that work to prevent youth substance use, a focus on tobacco prevention, in particular e-cigarettes, community-wide alcohol prevention strategies, and other topics as they arise. We're also connecting DFC coalitions to other programs and entities that we fund as an agency. Many of these are located within state health departments. And so we want to make sure that we are making that connection between the local level and the state level, especially with programs that focus on overdose prevention, tobacco prevention, alcohol prevention, and others. And we're starting to include DFC coalitions in some monthly calls with the networks that we have in place for our funded programs. And sharing coalition successes. We're building out some success stories and sharing those through the platform that coalitions use. It's called DFC Me. And we've also directed specific COVID-19 funding towards projects that will help address recent increases in overdose, especially among youth. One of these projects will examine how substance use patterns and attitudes among youth changed during the COVID-19 pandemic, how they're accessing substances, and what emotional and or physical support youth are currently accessing and what they may need to help them either decrease or quit substance use. And I should also mention that with any sort of training technical assistance, we do work in close collaboration with ONDCP and with CADCA, and especially related to issues regarding sustainability and coalition development support.
Sustainability, there's a whole nother episode bottled up right there in that conversation.
Very important.
Yes, indeed. Well, this has been awesome. Curious though, what other information from the CDC and from the National Center for Injury Prevention and Control that might be relevant to our coalitions in this area? What do y'all got?
Well, in the area of overdose prevention, CDC is improving the timeliness of fatal and non-fatal data on drug overdoses. And this is going to help us understand and respond to the rapid increase that we are seeing in drug overdose deaths involving synthetic opioids. And we highlighted this in a publication that we released. It's called the Health Alert Network Advisory, or HAN. And this was released back in December 2020. And that advisory, highlighted the increase in deaths and made a number of recommendations about ways to reduce overdose deaths. And those include expanding the distribution and use of naloxone and overdose prevention education, expanding awareness about and access to and the availability of treatment for substance use disorders, intervening early with individuals at highest risk, and improving detection of overdose outbreaks. And I would certainly be remiss if I did not acknowledge the COVID-19 pandemic. The communities served by DFC coalitions have been among the hardest hit. And I think people who are already struggling with mental health and substance use disorders in communities were particularly vulnerable to this virus that is highly transmissible and is still very hard to contain. On top of that, the coalition work has been hampered by the pandemic, and coalitions are used to working hands-on in their communities, but social distancing made it kind of impossible to connect in the traditional ways that have proven to be most effective. And the overdose deaths were already on the rise, but that provisional data from 2020 recorded the highest ever estimated deaths related to drug overdose, about 93,000 for a 12-month period. So I think all of us, coalitions, networks like the PTTC, CDC, and others are integral to reversing the arc of this epidemic. And as communities continue to face the pandemic, I feel like DFC coalitions will play an ever more critical role in supporting young people, laying the groundwork for prevention for future generations.
That is spot on. That is empowering. That is motivating and inspiring. Absolutely. Absolutely. The communities will be the ones to create that change now and for those future generations. I just want to sit and think about that for a moment. Great stuff.
Thanks, Dave.
So, now, I suppose we should wrap up this episode. And if you haven't caught on to the other episodes, I like to kind of end and invite our guests to share any final thoughts, any shout outs, or one of my favorite. If you remember one thing from this episode, remember this. What do you have for us?
Well, let me start with a shout out. I would like to thank Tracy Hardy, our project officer within our branch, for connecting me to you, Dave, and to this network. And so I would not be here without her connection to you and to me. So I would like to thank her for this, and to all of you out there for the great work that you're doing. If I had to say, if you remember one thing from this episode, I would say that DFC coalitions are doing great work in their communities and using that local knowledge to solve local problems. And they really are engaging youth. And that, I think, is really the most critical piece. And encourage coalitions from this region to apply. We're here to support you. We're here to provide guidance and support. And we're here to help you reach your goals and objectives. So please apply. And we look forward to working with you now and into the future to prevent youth substance use.
And listeners, check the show notes. There's going to be a whole list of great links and resources and ways that you can get support from the CDC, that you can apply for your very own DFC. And I don't know if y'all picked up on it or not, but I can hear it in Karen's voice. They do believe prevention is better together and that together we are stronger. And Karen, thank you so much. It's been an honor, absolute delight, and I'm feeling motivated. I'm feeling inspired. I'm feeling like I need to say, heck, I'm going to go apply for a DFC as well. You got me ready to go. Thank you. Thank you very much for all that you do, to you and your team. And thanks for joining us. Thank you very much.
Thank you so much, Dave. It was a pleasure to speak with you.
That concludes this episode. Thank you all for not only taking time to listen, but your continued work to make our region safe, healthy, and drug-free. If you'd like to know what training we have coming up, check out our website at pttcnetwork.org. And remember, prevention is better together, and together we are stronger.